Today we're talking to Dr. Nirali Jain. She is a board-certified OBGYN and fertility specialist, all about implantation bleeding. Welcome, Dr. Jain, and tell me, what is implantation bleeding?
That's a great question because that's one of the most common questions I get as a fertility specialist. So, implantation bleeding happens around day 6 through 10 after ovulation. So, in someone that's having a regular cycle, that fall around day 26 to 28 of a period. It looks a lot like day 1 of a period, where most of us have a little bit of spotting before the period actually comes down. So, implantation bleeding kind of resembles that. It's like this pink, brown spotting that is very mysterious and happens to so many people in early pregnancy.
And when it comes to implantation bleeding, how many days after sex would that be? Because sex does not always correlate with ovulation.
Yeah. So usually it happens really after ovulation. And so if you're having intercourse, about 3 days before and 2 days after ovulation, it would happen about a week and a half afterwards.
Okay, great to
Yeah.
know. And I think a common question people have is this is going to sort of coincide with the timing of your period as well.
Mhm.
So, how can you know as a patient if it's implantation bleeding or if it's your period?
Usually implantation bleeding is a little bit lighter than a period. It looks like light pink spotting or brown spotting. So a lot of patients say it felt lighter if they were to have a positive pregnancy test afterwards. But it's one of those things where you kind of look back on and then you realize. So it's not really it's impossible to tell until you take a pregnancy test and you're like, "Oh, that's what it was." You
Right.
know?
So, when can you take a pregnancy test and would you have to repeat it?
Yeah. So if you take a pregnancy test and it's negative and you're having spotting, I always tell patients to repeat it just 2 days afterwards because it could be that implantation bleeding, to get into the physiology of it, implantation bleeding happens when an embryo is trying to burrow itself into the wall of the uterus. So all these blood vessels are basically bursting and allowing for the embryo to implant. And that can happen at different times depending on when you ovulated, how long your periods are, when you had intercourse. All of those things kind of coincide together. And most of the time, about 70% of us do have implantation bleeding at some point. And sometimes that's followed with a negative pregnancy test. And then a few days later, all of a sudden it's positive, or maybe a faint test that gets darker over time. So it can really vary. I think the most sensitive thing, the best thing to do is to pick up your phone, call your OB, call your fertility specialist, go in for a blood test because that's when you'll know. A lot of the urine pregnancy tests don't even pick up. That's the thing. They don't even pick up a pregnancy until the HCG levels at a certain point. So we miss the implantation bleeding window.
And implantation bleeding basically is when the embryo is now embedding itself into the uterine wall. And it is only after that, correct me if I'm wrong, it's only after that that HCG starts being produced by the body.
Exactly. So we all have this corpus luteum, which is that follicle that releases the egg, and then the corpus luteum's job is to support a potential pregnancy. So it keeps your lining thick, it releases progesterone, and then after a certain period of time, it promotes that HCG rise. And it can happen in at different stages depending on when you're having regular periods or if your periods are irregular or not. So a lot of this HCG rise is very specific to the person, to the human, and not just something that we see on a graph, which makes it so hard. But you're right, the implantation bleeding happens once that embryo is burrowing. So it could be at an HCG level of 5 to 10 for someone, but then 20 to 50 for someone else. And that's what makes it hard to diagnose.
And how much more sensitive is the blood test in terms of how many days earlier would a blood test be able to detect implantation bleeding?
So I think this is pretty provider dependent and patient dependent, where some patients are like, I tested positive after an embryo transfer. This is kind of the cases that I see patients testing earlier than we recommend. But some patients test positive 6 days after ovulation. That's really, really early. The earliest that we test at our practice is 7 to 9 days after an embryo transfer. And that's when we start seeing HCG levels. We look for certain thresholds, but we see low HCG levels that turn into regular pregnancies. And then we see really high HCG levels that turn into miscarriages. So it's a very, very sensitive test, especially the blood work versus a urine test, because all these companies have different sensitivities of that urine test. So although we might think it's really accurate and we do recommend them, I tell patients don't be disheartened if you're having spotting and having a negative pregnancy test, come in for blood work because it just might be a low level.
On that same note, how many days after an embryo transfer would you expect implantation bleeding if it was going to result in a pregnancy?
So usually we tell patients the embryo floats around for about 2 or 3 days before it actually implants. And some patients have spotting, and it's definitely alarming, especially after you've invested so much energy into creating this embryo. And any kind of spotting, I think, is a red flag to our patients, although it might not be actually a scientific red flag. We'd expect it a few days after the embryo transfer because most of us put in a day 5 embryo. So it's already at an advanced stage before it actually goes in and burrows itself into the endometrial lining.
So after an embryo transfer, you're going to do a blood test to figure out if they're pregnant. Is that typically how it works? Or do you also recommend that the patients who are getting embryo transfers do a self-pregnancy test at home?
I actually recommend patients to not do a self-pregnancy test because I think there's a lot of false negatives and there's a lot of disappointment with that. And I do think stress levels impact the outcomes in early pregnancy. So I try to tell patients avoid it, but I know that most of our patients do go home and start taking these pregnancy tests at 5-6 days after the embryo transfer. And most of them, if it's going to work, they do get positives. So I'm not entirely disheartened when patients come in and they're like, well, I know I'm not pregnant because it's already negative on the pregnancy test because I know that blood level is going to be more sensitive. So I don't recommend it medically, but I know reality is reality. If I was a patient, I would go home, I'd run home day 5, day 6, day 7, you'd see all the pregnancy tests lined up. So I know what reality is, and I know that our patients do it. And I say, if that's going to make you feel better, if a faint positive line is going to make you feel better coming into our practice, because we do ask them to come in and sit in this waiting room, and that itself can cause anxiety, especially with pregnant patients that are also sitting in that waiting room. So say just test it if it's going to make you feel better. But at the end of the day, I only go by blood work.
This was really helpful. Thank you so much.
Thanks.